We are back on the Morning Brew, and I love it. We're talking with Dr. Wayne Kuang this morning. Welcome back.
Thank you.
And are you recovered? Because I know last weekend you were out doing a, what was it, like a 200-mile hike?
No, it was a 45-miler through the Olympic National Park.
And you had to pack everything with you. You had everything.
But it was awesome. We're hiking at 3 a.m., 2 a.m. in the morning, and the stars are out shooting stars and crashing out on emergency bivvies, and it's kind of a soulful, kind of like Finding the Buddha.
Like Eddie's new book?
Yeah, no, it's a soulful experience. I think it's good for guys to face, embrace, and move through their fear and allow their fear and their pain to set them free. And I think it's a good thing.
So how did that set you free? I mean, embracing that fear and all of that. I mean, like from your, if that's the philosophy, how did that work? How did that, in the end, like now that you're back, you're recovered, you're on the ground, you see yourself differently? It's
kind of I call it soul scrubbing.
Absolutely.
So when we all find different ways, I'm sure, like how did you tackle, hey, I'm going to write a book.
Right. You just do it. You just make yourself want to do it.
Right, but sometimes you need to kind of go through a mental, soulful cleansing process where you kind of break yourself down to the real basics.
Right.
And then from there you kind of get inspiration. Everything looks clean. Everything looks new. It's a brand new palette for your life.
Is that why you started your business too?
Kind of. For MDforMen, we wanted to change healthcare for men.
Right.
And whether it's prostate health, erections, testosterone.
Right, which is the month is
prostate cancer screening, 55 to 69. Talk to your primary care docs or so forth about getting screened for prostate cancer.
But when you were starting your business, did you just see like there's a hole here in how men's health is looked at by doctors?
Well, I initially started off with identifying there's a problem. Guys don't seek health care. We wait till it's too long. So for a good
is that just a thing that is that anecdotal, or is that actually a thing that guys do not look for health care?
I think it's not like they're not looking for health care, but they're kind of denying that they might have a problem.
Yeah.
Does that make sense?
Yeah. Is that one of those things that is there actual research to back that up, or is that just kind of the anecdotal thing about all of us in our lives?
I think there's soft data supporting that,
yeah.
And I think a lot of it is anecdotal and just how we know how we interact as men.
Right.
We work as the buddy system.
Right.
And, hey, Dan, I've got this problem. I can't pee. My flow's really bad.
Right.
I need help, man. Where do you go?
Right. And be like, I know this doc, MDforMen.
Right. Because there's guys who are suffering in the shadows.
Right.
Guys who are getting up 5-6 times a night and they can barely hit the toilet.
Wait, that's not normal?
So the problem with prostate health is that when your prostate health starts to decline, one of the big areas you stop sleeping well.
Oh.
And your sleep health goes down.
Is that because you're waking up to pee, or is that because...
Exactly, because when your prostate's like a donut, and you pee through the donut hole.
Right.
And as we all get older, women go through menopause, we go through MANopause, and the donut hole gets tighter, and it gets harder and harder for the bladder to push urine through. And as a result, your bladder starts to dysfunction, you're peeing more frequent, you may even leak on yourself, getting up in the middle of the night.
Is there exercises you can do for your bladder to make it stronger? I mean, it's a muscle, right?
There are, but obviously the primary issue is the prostate's getting too tight. So you got to open up that donut hole, whether with medications. At MDforMen, we've brought all the technology in-house. We have an ultrasound machine to see how big your prostate is, telescopes to see how tight the prostate is, and based on that, there's
splashing coffee.
Microwave therapies, laser therapies, robotic therapies. There's things to help guys, because we're living longer, guys need to live better.
Right.
And if we don't want guys to neglect their care.
Is this one of those things that identifying it early is better than anything else?
Yes, exactly. So that's an exact example of where if guys ignore it, eventually they'll stop peeing.
Oh.
Because their bladder will stop functioning.
Wow.
Start getting infections.
What
bladder
do you do
stones.
At that point?
Well, that's the problem. You try and salvage the situation, open up the prostate to salvage function, but also guys can go into kidney failure.
Wow.
And go on dialysis if they let it go too far. And so, and I'm curious too for you, how do you face your fears and kind of move through them? I think it's important people know you.
Yeah, well, that's a good question. I don't exactly know. To be honest, I think I just I'm scared of a lot, and so you just go out and do it. Like when you're on TV, I think is a good one. You just say, great, let's make this happen. You just try, I guess if you do it as well as you can do it, there's nothing to be afraid of.
Right.
If that makes any sense. Like on your hike, if you were out there and if you did the best you could do, and you were with a good support system like we got here, it's not scary.
Right.
You know?
And kind of like finding the Buddha in all of us, right?
Right.
It's living moment to moment.
Right.
And realize the future is just a series of moments. And as long as we apply ourselves to the best of our ability for every moment,
Right.
it's going to have the best outcome.
I like that. That's pretty good. I'm gonna start thinking that today all day. I'm gonna be thinking about it that way. You know, everything could be like my 6-minute segment.
6 7, yeah, exactly, exactly. But you know, for Prostate Cancer Awareness Month, obviously get screened for prostate cancer. If
Starting
you have
at
issues,
what age?
55 to 69.
Okay.
Earlier, if you have family history of prostate cancer or African American, and above that, have a discussion with your care provider to see if it's a good fit for you.
Yeah.
You know, and in addition to that, you'll learn more about your prostate.
And you guys also deal with some performance issues, which we can say.
Sure.
And like a friend of mine was asking me this weekend, he was like, those you want me to ask you if the little blue pills actually work, if they're a thing, or if they're just like a thing that like you see these ads for. You know, and is that like...
No, it works. The little blue pill, I mean, putting lead in your pencil, raising your game, I mean, all those things.
Whatever you want to call it.
Whatever we're allowed
right?
to say politely. Yeah, I mean, you know.
And is that a big part of the business? Is that a large part of what people come to see you? Is that a larger issue than...
It's becoming a larger part of the business. I'll tell you why. I think society's overstimulated. Our age group is totally overstimulated. We got to worry about mortgage, wife, kids, divorce, you know, raising kids and all this stuff. And we get there's so much static. And for men, for us to perform, it's a fine blend between mind and body.
Right.
And some guys, a little blue pill may help out, but also the aging process. Heart disease have the same risk factors. Smoking, high blood pressure, diabetes, high cholesterol affects your blood vessels of your heart, but also the blood vessels down there.
Everywhere else.
Everywhere
They
else.
all constrict.
They all can kind of narrow down. The plumbing kind of clogs up a little bit. Medications, injection therapy, vacuum erection devices, penile implants. Did I just really say that? Yeah.
You can say that.
Okay.
Yeah. Well,
you know, women
You're
have...
a doctor. If Eddie were to come on and say it, that'd be a different story.
Oh, okay. Well, you know, the technology's been there. Women have been using it for breast implants, breast cancer survivors.
Right.
Guys, we don't ever talk about this. The technology has been there for guys, but we're too embarrassed to talk about it. And so now we're doing community seminars to start the dialogue in the community amongst men that, hey, technology exists and guys can have a better quality life, not just for him, but also for her.
Yes. And is that one of the main things when people come into the office? Is it because the wife suggested?
Wow, great point. There's a high percentage of our guests, our clients, who come in because the partner picked up the phone, especially for new needle vasectomies, because the guys are just freaked out. But I mean, I'd say probably half of the appointments are made by the wives.
Really?
You've got to get this appointment.
Oh, that's pretty cool. That's very cool.
Yeah.
So that's it. There's no shame. And it's
a single 30-minute appointment. You're in and out, simple, safe, and effective. You lay down. You don't have to have your legs on there. It's easy.
I love it. I love it. Well, we're going to be back in a couple of seconds. Eddie's going to talk about his new book, and then we've got our friends from the Viadoro here. Did you meet them?
Yeah, I heard about that. Sounds like a fun time this weekend at the Viadoro.
Great. Well, we'll be back in a couple of seconds on The Morning Brew.
All right.